time for Dr. Kevin McHale, Cape Regional, and Penn Orthopedics, the best of both worlds for a healthier life. And, of course, there's a lot of injury stuff, interesting stuff in this area as always. Today's injury report brought to you by Cape Regional Health System with Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. Welcome back, Doc. I hope you had a nice vacation.
Yeah, it was really nice. Nice to get the family away and get a little break from work, so always welcome to take a little time off.
Well, it was not a good week for the Eagles, and always interesting stories there. So let's start with this Darren Sproles hamstring issue. I know we talk about hamstrings from time to time, but he hasn't played all season. He was ready to come back after 9 weeks. In fact, they released DeAndre Carter thinking that he was ready to go. He had a setback. So I guess my question for you is, you've dealt with hamstrings, I'm sure, with NFL players in the past. Could it be more? Could his ACL injury from last year be a cause here? Could it just essentially be he's 35 years old?
Well, you know, regarding the ACL, a lot of times recovering from a major injury like an ACL injury can be indirectly related. It's probably not the ACL itself that's the problem. It's just that recovering from a big surgery like that puts you at risk for the hamstring injury in the first place. You know, we talked about some of the risk factors for hamstring strains, and muscle weakness and imbalance can cause that. And the most common way we do ACL reconstructions in elite athletes is to do what's called a patellar tendon autograft, where you take a strip of their patellar tendon. And as a result, the quad, it takes a little bit of time to recover from that surgery and can lead to a little imbalance between the quadriceps and the hamstrings, and kind of puts these players at risk for injuring it. And then on top of that, you know, the lack of being in perfect fitness, because these guys are in top shape at the beginning of the season. Clearly, he's a little behind in his strengthening at the start of the season because of his delayed rehab from the surgery. Kind of puts him at another increased risk there. So the fact that he had the ACL surgery likely plays an indirect role in why he had the hamstring injury in the first place. But this lengthy duration probably has more to do with the severity of injury that he had. You know, we don't know exactly what the MRIs look like and where exactly the injury is. Most of the time when we're talking about hamstring strain, we talk about the muscle itself being strained, the fibers in the middle of the muscle. Sometimes if it's a real severe injury there, it can take a long time to get back. Other times, if it's more where the tendon's attached to the pelvis at the top of the hamstring, these are a little bit more notorious for a lengthy rehab. So it could be possible that maybe he had one of these different types of, a little less common type of hamstring strain that has a lengthier return. Regardless of the kind that he had, it was clearly severe. He was out 10 weeks, had this re-aggravation. You know, when players have a little setback where they just maybe some increased soreness and there's a delayed 1 week or so return, we're not as concerned. But the fact they're already saying he's going to be out about 3 to 4 weeks means that he likely had a pretty significant re-injury, and that's concerning for him, especially at his age. You know, he already said this is likely his last season. So we really want to see him back out on the field this year, but it's looking less and less likely. If he has another setback like this, it's likely going to be on the IR for him.
Yeah, he is expected to miss multiple weeks with this latest injury. Darren Sproles not going to play again this week against his former teams, the Saints. I want to go to Tim Jernigan. He's back on the practice field, had surgery to repair a herniated disc in his back in May. So with that timeline, Doc, would you anticipate that he would be available to help out around this time or at all this season? I hear herniated disc in the back, and I always get concerned with back injuries.
Yeah, I mean, it's completely reasonable to get concerned with back injuries. So with these herniated discs, about 20% of players don't get back to playing in the NFL. So it's a real legitimate injury. It's a significant injury and something not to take lightly. That being said, all of the 80% that get back, the good news is they play pretty well. Studies show that they have a pretty equal performance after getting back from a herniated disc surgery as they did before the injury. So we can expect that, maybe after a few games of knocking off the rust, that he should be able to play at a high level just like he did before. This timeline seems about right. It's about a little over 6 months since his surgery. So he's gone through all the rehab. It seems like he's progressing well. Sounds like from him being lifted off the non-football injury-related list, he's got a couple of weeks to get back to play. I think he's got a week or two. So whether it's this game or next game, it's very likely that we'll see him out there. And I think he should contribute very well once he's there.
All right, the last one that we want to dive into is maybe the most controversial one in these parts, Doc, is Markelle Fultz. And we've all seen what's happened with him. You saw him at the foul line the other night. He kind of had that double clutch. He kind of had a hitch in his shot. He said the ball slipped, but I don't know. I'll let you evaluate that. My question is, would that scapular imbalance that he had last season still be an issue, or does his shooting appear to be mental? I know that's a very sensitive subject with, you watch this guy play, he won't shoot the ball. His trainer indicated he was still hurt in a tweet. He then deleted the tweet. There's been some reports that he and the trainer are no longer speaking. We don't know if it's because of that tweet, but would you surmise that that scapular imbalance would still be something that could be lingering, that is preventing him mentally from wanting to kind of full-fledged let it fly for all intents and purposes?
As a doc, I wish I could tell you that it was this medical issue and in 4 weeks he's going to be back to shooting like normal, but it doesn't really seem to be the case. When we talk about scapular dyskinesis, it's a dysfunctional or abnormal motion of your scapula, and it really throws off the way you use your upper extremities to do stuff. So with complex activities like sports and shooting a basketball, they can absolutely play a role. And there's a lot of studies that show that it can take a very long time of doing rehab to get your normal motion and strength back and get back to normal play at the same level of play and sports. Most of the time, we're talking about 6 months, which is a long time. It's a season or longer. But at this point, it's a little less likely that his play is related to the shoulder itself, but the mental thing is a real component that could be playing a role. There's actually specialists like sports psychologists that are part of these teams that play a role in talking to these athletes and helping them through tough times in their life and dealing with what it's like to be in the pros and the pressure and all that kind of stuff. And it's a real thing to consider, and he was a number one pick, and there's a lot of pressure on him. Maybe the recent trade acquisition of Jimmy Butler will take some of that pressure off him and help him a lot more than quote-unquote physical therapy for his shoulder. But we'll see. It's really tough to see somebody of his caliber playing like this, and we really want to see him play like the number one draft pick that he was.
Yeah. So essentially, I guess about this time last year, we were talking about this scapular imbalance that he had. Here we are almost a full calendar year later. It's pretty tough to surmise that he might still have pain from that.
Yeah, we don't always know what's going on with every athlete. Just a lot of these athletes may have these, more minor injuries that they don't get reported in the public. We don't have access to exactly what's going on and what the examination's like. And it's very possible that he could have some injury playing a role in this. But, based on at least what's released to the media and what we're aware of, it really doesn't seem to be the case. And hopefully he can just kind of work through this and get back to playing like his normal self.
And you talk about the mental aspect of it. There might be that situation, like, for instance, on a very small level, I have this little tweak in my bicep area. It doesn't hurt all the time, but every once in a while, Doc, I might go up to wash my hair, and I'm like, ooh, that hurts. So it's not every day that it happens, but it's at least in my mind that I am careful enough that I'm like, I don't want that pain to happen again. So he might shoot 50 times with no pain. That 51st time is when he feels it, and he's got that worry that if he lets it fly, he's going to feel that again.
Yeah, we talked about that a lot when we were talking about Carson Wentz coming back. After a major injury, is he going to be playing like the same player? Is he going to be attempting to make the runs like he normally does? Is he going to have that kind of mobility? And a lot of that is the mental component, that fear of re-injury, right? That he went through a really big injury, a big rehab. Is he going to get back to full strength out there, and is he going to be just as aggressive of a player as he usually is? A lot of these guys rebound so quickly. We expect that to be the norm. We expect them all to recover from an injury and get right back to the same level of play that they were before, and that's our expectations, and we kind of just get used to it. But in this case, it seems like that may not be the case, and it may be that exactly what you're saying is right, that maybe it is a fear of injury, whether it's just the pressure of it all or just kind of just getting his rhythm back that he used to have. He's having a real hard time getting there, and hopefully we can watch him get there soon. But I'm not sure when that's going to be.
All right. Of course, every week right here, the Injury Report with Dr. Kevin McHale of Cape Regional Health System and Penn Orthopedics, the best of both worlds for a healthier life. For an appointment, call 609-463-CAPE or visit caperegional.com/orthopedics. It's the Eagles and the Saints this Sunday down in New Orleans. And, of course, Doc, we appreciate you jumping on board as always.
Yeah, no problem. I'll have the same problem as you starting Breeze against our Eagles this weekend on my fantasy team. So never like to root for a guy going against our team, but we'll see. Want to get a fancy win, too.
That's a good reason for me to go to Mahomes, so I don't have to cheer against
Yeah, there you go.
All right, Doc, take care, man. He appeared via the Boardwalk Honda hotline.